1 in 8 women. My sound is too much.
Few things. Why we are having this awareness every October? See, the awareness program started since 1985, and from 1990 onwards, the decline of the incidence of breast cancer. So there is a lot of influence of this awareness program in bringing down the incidence of breast cancer. Still now, we have almost 2.3 million new cases every year. And certain facts regarding the breast cancer is most of the cases, the identifiable risk factor may be just being a woman or an advancing age. In 70% of the cases, we cannot identify any risk factors. Also, few cases are identified as with genetic predisposition, that is almost less than 5% of the cases. And certain other factors are the survival rate of the breast cancer, if identified earlier, is much more, is almost nearly 99% now with advanced treatment. When it is diagnosed at a very early stage, like an isolated lump without any spread. But if it starts spreading, the cancer spread, the survival rate gradually declines to almost less than 70%. And another fact is that, in 40% of the cases of diagnosed breast cancer, the woman usually presents with a lump. When the woman presents with a lump, only it is being diagnosed. So all these show towards regarding the importance of the awareness of the breast cancer, and also the importance of the self-breast examination and the regular screening, and also approach to the medical facility at the earliest. I am here not to scare you, just to make you aware of yourself. Now, what is cancer? Actually, it is the uncontrollable abnormal replication of cells which produces cancer. Normally, for any individual, regularly there is a multiplication of cells in the body. And the first, you can see in the normal cell division, you can see a green color cell. That is an abnormal cell. If our host, if the body immunity or the health status is good, usually this cell will die by itself by a process called apoptosis. That is a natural defense mechanism of the body. But if any factors is favorable for its proliferation or replication, it will just go ahead with continuous replication of the cells, finally resulting in cancer. Now, what is breast cancer? It's a tumor arising from the cells of the breast, and it is the second most common cancer, and also it is the second most common cause of death among the cancer of women. From where does it arise? The breast tissue, there is a glandular tissue which secretes the milk, and there is a ductal system which drains the milk to the nipple. So, the cancer can arise either from the lobules or from the duct which is draining the milk. Mostly we see, the commonest is ductal carcinoma, and actually that presents a little late with a lump. And what are lymph nodes? We always, you have heard of the lymph nodes. The lymph nodes are small organs in the body which will drain a foreign body. So the abnormal cells will be just drained at the lymph node. That's why the lymph nodes become enlarged in a case of breast cancer. And then the cancer can spread. As the circulatory system is cancer, but the incidence is very less when compared to the woman. When 135 to 138 woman is affected with breast cancer, one male is having affected. Now what are the risk factors? See, the risk factors can be classified into two. That is, one is uncontrollable and which is controllable. Uncontrollable are the risk factors, it is the family history, we don't have any control over it. Our relatives or close siblings or maternal cancer, then again the risk increases. Also, genetic predisposition. See, the high risk woman can have a screening with the breast cancer antigen gene, that is a BRCA1 or BRCA2. And another thing is that previous history of radiation to the chest wall for any other kind of malignancy. Then early menarche and late menopause. Again, the age of menarche is again, it's not under our control, and also like menopause. Again, the controllable risk factors are, one is obesity. Also, the older age at first live birth, or when a woman has first delivery at a later age, the risk for breast cancer increases. Nowadays, the problem is the women are getting more education. They are finally with their degrees, then their career, all finally getting married little late, and again first pregnancy comes at a later age. Again, it predisposes to a risk for breast cancer. Another thing is that again alcohol consumption. They should minimize the alcohol consumption, and they should not, or even if at all, very minimal. And then breastfeeding. It is not written here. Breastfeeding. A woman who breastfeeds the baby for long, the risk will be reduced. In this context, I would like to say one thing. I told you about the BRCA1 and BRCA2 genes. So the women who are at high risk, if they have the screening in Western countries and all, even they advise regarding a prophylactic mastectomy. Once a family is completed, they can undergo a prophylactic mastectomy to prevent it from developing. When we talk about the breast cancer, mostly the breast cancer occurs at advancing age, or the incidence increases after 50 years, even though young girls are also being affected, and they should also be aware of this and should take part in the self-breast examination. Screening can be of breast cancer. You should be aware of such a situation, and you should be regularly doing the screening. A breast self-examination is that which a woman does at home, and a detailed when to do the self-breast examination. So, menstruating woman should do the self-examination about 1 week after the period is over, because during the period the breast is very much congested and maybe tender also. So, if you do the examination 1 week after. So, it has to be repeated every month. And also a woman who is menopause, examination, they have to fix a day, like first or 10th or 15th, like that, convenient for her, and should do every month, the same day. Now what to look for? You can see a pain, you can see a lump, it may be painless, it seems like a projection, or it can present like changes in the breast size or shape. You can see that the nipple is retracted, an inward drawing of the nipple, or it can be an abnormal discharge from the nipple. Needn't be always bloodstained discharge, even a watery discharge from the nipple. I have seen malignancy. Many a time, the woman just a watery discharge came, and everything was normal. On palpation also nothing was there, but still asked for an ultrasound, but then diagnosed with this ductal carcinoma. Also, you can look for the changes in the texture. You can see the skin, whether it is irregular, whether there is any puckering, whether there is any drawing of the skin, or like the edema of the skin. We call that a fluid retention which produces like a orange peel appearance. Also, breast pain. Needn't be always without pain. A breast pain also can be a sign of a symptom of breast cancer. Now, breast self-examination, it should be done in 3 postures. Actually, every woman, they should expose themselves in the front of the mirror and should have an idea of our own breast. Because there's normally, as the difference in both the eyes, the breast also will not be symmetrical. So that asymmetry is normal for that person should be known by her in the beginning itself. So that they'll be able to notice any difference in the further ongoing examination. So the inspection just in front of the mirror is very important, and that should be done in 3 postures, like the arms by the side, and also the hip on the arms on the hip, and also by raising the arms above the head. And in details she will say. Again, the examination by palpation is very easy when it is done under a shower, because the water, and with a mild soap, you can very easily palpate any irregularities in the breast tissue, and it will be comfortable also. And also, you have to do the same thing on the other side also. And next should have an examination in the lying down posture by circular motions. Details next is becoming, now we will tell you. And finally look for the any discharge also. The rare signs to be aware of. You needn't be always present with a lump or retraction or a discharge. You can see as a red patch over the breast. And I have seen a case which was very bad. The woman had some reddish pigmentation over the breast, and she was thinking it as some infection of the skin. Over the counter bought some medicine cream and applying since many years, and finally it was keeping on. It was kept on spreading, and she has come. And then, it was an inflammatory carcinoma. It's a condition called inflammatory carcinoma where patchy color, red color, patches over the breast. And some areas you could see that purdy orange appearance. Purdy orange means the orange peel-like appearance like this. Now what is mammogram? Actually the mammogram, it is taken, the breast tissue is just pressed between 2 plates, and then it is screened. And the first you can see is normal, nothing is seen in that picture. Second you can see well circumscribed lesion, and that is not cancer, it is a benign cyst. And the other you can see it is very irregular, and so it is easily picked up. Before palpating before a lump is being palpated, a mammogram can detect a breast cancer. Now when to screen? From 20 to 40 years, every 3 years, they should have a screening. And after 40